Sarah Duvall here from coreexercisesolutions.com, and I've got a good question today. What are some of the symptoms of a tight pelvic floor? This is a question I get all the time because women are trying to figure out, is my pelvic floor loose? Is it tight? I read this article about if it's tight, I can't contract well, but I can't tell if I'm just weak or if I'm tight and weak and what's going on. All right, so I like to think about this in layers. So you've got your kind of mild pelvic floor tightness, which may or may not be easily identifiable. Okay, so I've got those ladies who maybe they see their pelvic floor PT and they don't really find any obvious trigger points. And so the PT's like, well, you don't really seem that tight, but they're still experiencing what I would call some symptoms of pelvic floor tightness. So this is gonna be a very low level, but it's obviously gonna affect function. So some of the things they describe would be difficulty breathing down. So they try to inhale, and they feel like their inhale kind of hits this wall and doesn't go all the way down. They feel like they can't inhale into the sides of their pelvic floor and send that pressure down with their breath. I still consider this a increased tone pelvic floor, maybe not necessarily a tight pelvic floor per se, but there's definitely an increased tone so the pelvic floor is not working well with the diaphragm, which is going to decrease optimal function. And then as we go up in these layers, we get a little bit more severity. So you might find some trigger points in the pelvic floor muscles. This might lead to like some deep butt pain, or you might have pain with insertion with a tampon or with sex. And so pelvic floor tightness can be on all these levels. So if you're postpartum and you're having a bit of pain with sex and extra lube has not fixed it, then you might want to think about seeing a pelvic floor PT for pelvic floor tightness. Now, I also like to look at all the other reasons for pelvic floor tightness. The pelvic floor tends to be a compensator. All right, the pelvic floor is in the middle. It's like, ooh, I can do all the work. And so what's going on with the glutes? What's going on with the hips? What's going on with the abs? All right, what might the pelvic floor be compensating for? And that's the reason why the tightness keeps coming back. So it's one thing to identify you have tightness, but it's another to not identify why, because then often you get in that feedback loop where you get release work done and then it comes back. So finding that reason on why you tend to be tight, is just an area you hold tension in, or is it a deeper problem? Okay, so digging in, so hopefully that will help you with thinking about what are the symptoms of pelvic floor tightness. And it can be as simple as feeling what's happening with your breath, which just involves a little bit of meditation and a little bit of body connection where you can feel what's going on. And if you can't feel that breath go down, then that might be a clue, like, aha, I've got increased tone in my pelvic floor. Why do I have increased tone in my pelvic floor? And that is a great question. And then those major symptoms are pain with insertion. Okay, so don't think it's normal if you're having painful sex and this is something that you've like, oh, I guess this is just normal since I'm postpartum now, or I'm menopausal now. Please get help for that, because there are things that can be done to help pelvic floor tightness. All right, so hopefully you took something good away from this video and helped to learn what pelvic floor tightness might feel like and some of the causes. If you did take something away, please hit the thumbs up button below and subscribe to my channel, because I'll be sending you lots of great information.